last year in 2021, July 15th, July 15th or 17th, just the problem arose for me. So I could not lift the right leg on while sitting on a vehicle.
So Triveni is a case of ligamentum flavum hypertrophy. So when she came in before the injury also, she had weakness in her bilateral lower limbs. Around 2-3 months she had weakness. That's what the history behind this. So slow day by day it started deteriorating, and one fine day she fell in the bathroom.
Spasticity for a lay person is trying to drive the car with the handbrakes on. That means internally there's some handbrake happening and it's resisting your movement that is happening. And spasticity is one of the commonest ways the nervous system recovers after injury. Okay, so there are two kinds of spasticity. You have helpful spasticity and harmful spasticity. Sometimes when there's a weakness in the limb, the spasticity is important to maintain the position of the limb. But if it crosses a certain line, then it becomes harmful and comes in the way of day-to-day operations. So the joints start wearing out faster, they get pain, swelling and everything else. So now how do you release spasticity? Releasing the handbrake and releasing spasticity is the same. So you have focal spasticity, which is small groups of muscles. Spasticity is basically over tight muscles that we have. So, or it can be generalized depending on that. Depending on the extent of spasticity, the treatments vary. A lot of medicines available, but many times those medicines don't work, or they're not enough, or they cause drowsiness and things like that. Then we start looking at other options. In the other options of treatment of spasticity, one is called the botulinum toxin, or Botox that we call, that we can inject into the groups of muscles that are tight to release the muscle. It's called chemodenervation procedure. It's a reversible procedure because it only lasts for 3 to 6 months, after which the spasticity can't come back. Other one is for a generalized spasticity, is called intrathecal baclofen pumps, or ITB. I've implanted an intrathecal baclofen pump for her in the anterior abdominal wall with a tube that is going into her back, and which is this pump has a tank capacity of 40 ml, and inside which the drug is placed, and that drug at a pre-programmed rate is delivering the drug through this spinal cord tube into a particular space on the spinal point on the spinal cord, which I have determined and kept the tip there. All right. Now this can be programmed, adjusted to as per the patient's requirements and needs. Normally we give a standard continuous dose for 24 hours. This is at micrograms per hour. Normally the drug is given milligrams in the orally, but somehow doesn't work because 90% of the times the drug doesn't cross the blood-brain barrier, which is like a checkpost in the brain. So now what we have done is, in her case, she is fine the whole day. From 9 o'clock in the night till 5 o'clock in the morning, she has some problems specific to that time, which involves tightness of the leg, lot of pain in the leg, and difficulty in turning in bed. So this programmer is designed, and the pump is designed in such a way that I can give additional doses at that particular point of time as per the patient's need.
So after ITP pump, muscle power improved, pain became completely, it stopped. Night are peaceful for her now. She is able to sleep properly. She is able to roll on herself independently, and then she is able to come up to sit to stand also. She is doing it independently, and then now she is walking without without any help. Only she is only holding the walker, and under supervision she is able to walk.
Everything I am able to do myself. I should thank Sir Sharan Srinivas. Srinivas, I always pray Lord Balaji only. It's my favorite God, I can tell. I see doctor as God only. can't express my feeling. How this 10 months, it was each day it was terrible for me. Now I am thinking, after some days I can walk, I can go to my job, everything. I should thank my therapists from day one to till now. Divya was in my journey only, and the other therapist also helped me more. Standing, I can tell Dikshita, Sona, all how they taught me standing. I can't forget. They are all a part of people in my family. Now I should think, because without them I could not achieve this success also.